Hi, this is Dr. Shaikh, consultant orthopedic trauma and joint replacement surgeon. I practice in the central Mumbai suburbs. Today, we are going to discuss a few salient features of osteoarthritis, primarily osteoarthritis of the knee and hip. We are going to discuss some few aspects of the causative and risk factors for these osteoarthritis, and a few do's and don'ts on how to go about managing these. To start with, osteoarthritis of the knee is more common in our subcontinent, especially in India, because we have this habit of sitting on the floor, sitting cross-legged, and we also use the knee a lot as compared to the Western population who have more instances of osteoarthritis of the hip because they have a habit of sitting on the chair. Now, osteoarthritis of the knee primarily occurs because of one, degenerative process in the knee. Second, because of some underlying disease factor. So most commonly, primary degenerative osteoarthritis of the knee is what we see in our day-to-day practice. Most of the patients who suffer from this osteoarthritis present to the doctor in an advanced stage or at least in a moderate stage. They don't come to the doctor when they have milder symptoms. Osteoarthritis of the knee, if has to be treated medically, is best treated when the patient has mild to moderate symptoms. Osteoarthritis with severe symptoms is seldom treatable with medications, and they most often land with requirement for joint replacement surgeries. A patient who starts developing symptoms of osteoarthritis, like pain and stiffness in the knee, should consult an orthopedic surgeon as soon as possible. A few non-medical aspects of treating osteoarthritis, like the do's and don'ts of it, is first I would talk about the do's part. Try and maintain a healthy lifestyle, a healthy weight. Try not to become obese. Try to be very active. Keep regular walks. Avoid jogging. Avoiding too much of pressure on the knee is a primary requirement. Avoid eating a lot of junk food. The other do's would be strengthening exercises for the knee, strengthening exercises for the thigh muscles and the calf muscles. The don'ts would be to avoid climbing up and down stairs, avoiding sitting cross-legged on the floor. The other important thing is to maintain good bone health, and that can be maintained with the help of exercises. Other than exercises, supplements like calcium, vitamin D, and joint nutritive supplements definitely help. If the joint is acutely painful, anti-inflammatory drugs would definitely help. And as I said, if the patient is having severe symptoms, then unfortunately there is very little with medications that can be done. Surgery becomes the only option.